the history, okay? So, before it was called novel coronavirus or nCoV, no? January 9, 2020 is the first case that was identified by the Chinese authorities, and the virus is associated with an outbreak of pneumonia in Wuhan City, Hubei province, and China. So, dun sa mga nagkakasakit, nagugulat sila kasi the X-ray result is nagkakaroon ng fibrosis or pag umabot sa heart, nagkakaroon ng myocarditis. So, meaning, hindi nila maintindihan what is happening during that time. So, sabi nila, nagtago yung Chinese tong Chinese government sa world, no? Nagulat na lang tayo, nagkaroon ng pandemic itong COVID-19 or nCoV during that time. So, the outbreak is associated again, the agent, the host, and the environment. And the outbreak is associated with exposures in one seafood market in Wuhan, in which the market was immediately closed in January 1, 2020. Two things. Ang mga Chinese, they really wanted to uh, celebrate New Year and Chinese New Year. So January 1 ito kinlo. So ibig sabihin December, talagang ang dami nagpupunta dun sa Wuhan. Kasi sa tourist pa, tapos nandun yung, marami talaga, makikain talaga yung mga Chinese. Sorry na lang sa mga Chinese dito, no? Pero talagang, since maraming Chinese dito sa Tacloban, when I first came in 1993, grabe, lahat ng kanto may kainan, no? Tignan mo lahat magta-tribe talaga kasi kain ng kain. Okay? So thank you dun sa mga naka live video kasi supposed to be one of the rule in our PCM, either talaga kayo, you have to turn on your video all throughout the lecture. Okay? So, the cluster was initially, nagka-clustering na, no? The cluster was initially reported on 31 December 2019, and a new type of coronavirus was identified on January 7, 2020. So, of course, this is not the only coronavirus. Hindi talaga siya nCoV because there are other respiratory pathogens such as influenza, avian influenza, adenovirus, SARS-CoV, Middle East is also a CoV, were ruled out as the cause. So ano kaya ito? Pero ang presentation niya is still a respiratory infection. Pero is it a virus or is it a bacteria? So, COVID-19 is from the family Coronaviridae, and there are 4 genus: Alpha, Beta, Delta, and Gamma. And it uh it came from the group 4 positive ssRNA order Nidovirales and subfamily Coronaviridae. So yung nila, our common colds, our SARS, our MERS are all coronavirus. I think it's beta coronavirus. So hindi siya new and pero ito, bakit anong pagkakaiba? So is it a conspiracy theory? Or is it really something new? Okay? So if I remember it right, during the time of AH1N1, that's an avian flu, we have 10,000 cases pero walang namatay. Even mayor, my son, mayor's son, mayor's daughter, may natamaan nitong AH1N1. Pero we have 10,000 cases pero wala kaming death, no? Ito, we only have 2,000 cases but we already have 48 deaths as of this time. Okay? So, coronavirus are named for the known like spikes on their surface. So, there are 4 main subgroupings as I have mentioned, alpha, beta, gamma, and delta. And then human coronaviruses was first identified in the mid-1960s. Ito, January to 2020. So ngayon may changes na kasi meron nang nag-evolve na. Meron na yung South Africa and the Brazil, no, UK. So there are more or less 4 common human coronavirus, the 229E. Very important kasi yung mga numbering eh. It's an alpha coronavirus. We have the NL63, also alpha, OC43, which is beta, and HKU1 beta coronavirus. But there are also other coronavirus, which is the MERS-CoV, yung Middle East, no, respiratory coronavirus, and SARS, that is also a beta coronavirus, and now the COVID-19. Okay? So, every organism, infectious organism, tatandaan nyo to, Kasi that is where we are going to break the chain. Kailangan ma-break yung chain in order to, saan ka ba? Are you going to prevent the agent? What will you do? That's why we have antiviral, we have antibacterial, or are you going to target the host? That's why you have to increase the immune system, magbigay ka ng prophylaxis sa host, or on the portal of entry, you're going to have like shield mask, or to the mode of transmission, is it direct or indirect? So for the mode of transmission, you cut it by for example, if it's droplets, so magkakaroon ka ng nagmi-misting ka, or probably stop the transmission by disinfecting, or the portal of exit if it's in the if kahit lahat ng lalabasan, no, lahat ng papasukan at lahat ng lalabasan, and of course the reservoir. This is one very important slide that you are going to use even next year pag nandun ka na sa microbiology, kasi infectious agent, micro and parasitology, titingnan mo yung chain of infection, no? So, for this coronavirus, the infectious agent is a virus, no? It's a coronavirus, and then of the beta order. And then, the susceptible host, as of this time, it's still humans. Although, sabi nila, mukhang nakuha ito dun sa, ano yun, ano yun? Pangolini or bats, no? So, the only susceptible host is humans. It depends on the age. That's why yung mga merong vaccine, kaya nga itong Sinovac is only being given for 18 years old to 59 kasi wala pang study ito na vaccine sa 60 years old and above. What about pregnant women? What about below 18? What about senior citizen? And of course, you consider in the susceptible host the immune status. And then the portal of entry for nCoV-19, no, is the mucous membrane and respiratory. It's still the respiratory. Kaya nga palaging ina-advocate yung washing of hands, no? And of course, the mode of transmission is either direct or indirect. Direct, ito yung men sa mouth, sa eyes, sa nose, and or indirect dun sa mga objects, no? Katulad halimbawa, pumirma ako, hindi ako natalsikan ng laway, ipinasa ko or humawak ako sa doorknob, those are indirect transmission. And of course, the portal of exit is on the gut. And the reservoir still human, no? And live and grow and reproduce sa human. So, ang sabi nila, ito na UK variant or yung South Africa variant, yung meron ngayon sa yan na naman. Meron yan sa Manila, NCR, and Cebu. Ang sinasabi nila, nothing to be alarmed. 'Di ba ganun din? January, hindi kailangan magmask, sabi ng WHO. Nauna ang Tacloban magmask. After ilang days, nagpamask na sa buong Pilipinas, sa buong mundo actually. It's not only buong Pilipinas, but sa buong mundo. Sabi nila, nothing to it's not yet, it is still manageable. After 1 week, it is now pandemic. No? Pandemic proportion, pandemic, buong mundo na yun. No? So, yun yung natin. Now that we have the UK variant and the South Africa, paano natin to na ngayon na ang vaccine available, since tayo ay third world, hindi pa pwede lahat ng vaccine. At saka sa sa status natin, hindi natin kaya yung -70, -20, both for Pfizer and Moderna. So, COVID-19 spreads primarily from person to person. So, droplets, hindi siya airborne. They thought before it might be airborne. TB bacilli is airborne, no? Sa TB, Mycobacterium, it suspends in the air. Kaya, ang taas ng infectivity ng TB. Tapos, even, halimbawa, dumura ang isang may TB and highly infectious siya, it will stay even for a long period of time sa lupa. Kaya, nangyayari, di ba? Tayo pag umuulan, kino-cover natin yung likod natin. Dapat ang kino-cover natin yung nose natin. Kasi pag ulan na yan, hahangin, magsususpend ito, we need to protect. Kasi ang ulo natin, yan, wag natin i-cover yung ulo, i-cover natin yung likod at saka yung face natin, no? So, droplets released when someone sick, sneeze, or coughs can land on the mouth, nose, or people nearby. That's why, kailangan at least 1 meter apart. So, close contact with someone sick, like hugging or shaking of hands. Kaya wala ng beso. However, the indirect is COVID-19 mainly spreads from person to person, but it can also be left on objects and surfaces katulad sa elevator, katulad sa laptop, sa mga mouse, digital devices, sa mga tissue, sa doorknob, pens. Kaya dapat separate yung mga ano, kung meron kayong kung naging close contact kayo, you have to have a separate bin, no? Yung trash bag for you. So if you touch something contaminated and then touch your face or another's face, you might all fall ill, no? Pwede tayong magkasakit. Okay? So, how the coronavirus is spread? Viruses can spread from human contact with animals. Scientists think MERS started in camel, while SARS from civet cats, no? So, yung civet, sino nakakaalala sa inyo ng civet? How do you understand civet? Ara, Dr. Rakamasin. Or you know what civet is?
Wildcat.
Wildcat. It's a wildcat. Ano pa? What is, saan famous ang civet cat?
Wala.
Yes, yung coffee. O maki-coffee. Sino ba maki-coffee dito? Grabe. Ako, maki-coffee talaga ako. I wanted to, kaya lang nagkasakit ako ng the past week. And something is wrong with my retina. Di ko alam kung dahil sa kaka-ano na to, kaka-zoom and ano. So, thank you for being gracious to me, no? Dahil hirap talaga ako. Ganun pala, pag nagka-problema yung retin, wala akong mabasa, wala akong makita. So, puro floater yung nakikita ko sa mata ko. So, the civet cat is, pinakamahal na coffee that you can have is from the pupu of the civet cats, no? But of course, buti na lang hindi galing doon ng COVID, no? So when it comes to human transmission of the viruses, often it happens when someone comes into contact with infected person's secretion. So our secretions can be from the mouth, from the nose, from the eyes, and from the poops, no? Kaya minsan, kaya na nila na dati wala yung diarrhea. Ngayon, diarrhea is part of the signs and symptoms of COVID-19. So depending on how virulent the virus is, a cough, a sneeze, or handshake could cause exposure. The virus can also be transmitted by touching something an infected person has touched and then touching your mouth, your nose, or eyes. So caregivers can sometimes be exposed by handling a patient's waste, no? Of course, until now, there's no specific treatment. Most of the time, symptoms will go away on their own. So there are many trials. They have the trials of the antiretroviral, the remdesivir. They are trying the dexamethasone. It's a steroid. So take note na lang yung mga pinagsasabi ko, no? Because they thought that there is an inflammatory process, no, in COVID-19. So they start with steroids. And then, of course, pag nagka-pneumonia, you are going to treat it with antibacterial and the drug of choice is azithromycin. Okay? Sabi nila, a room humidifier o hot shower can help with the sore throat or cough. Tapos, ano to? Suob-suob ng Cebu. Tuob, ano ba? Tuob, suob. Tuob, no? Yung sa Cebu, mga Cebuano diha, no? Kaya si Governor Gwen, no? Ang pinamimigay nila, palanggana, kettle, no? At saka palanggana, kettle. At pa isa? So yun ang pinamimigay nila. And of course, drinking plenty of fluids, adequate rest, and sleep will help. Okay? Studies show that more severe version of SARS and MERS and SARS coronavirus can be serious. And this is what is happening to COVID-19. So, sa MERS naman, there are cases in which a woman infected with MERS had a stillbirth. Wala pang study na ginagawa ngayon sa COVID, but I think if you go into kay Mr. Google, no, makakakita kayo na baka there might be a study on among pregnant women, both for the vaccine and for the virus itself, no? SARS-associated illnesses were linked to cases of spontaneous abortion, maternal death, and critical maternal illness. So, I can give you data of like in 2020 and 2021. We can start analyzing how many of them are pregnant, how many of them are our healthcare workers, no? Bakit siya nagtatransmit ng ganito? Is it because of the viral shedding? Okay? The clinical symptoms of COVID-19 until now there's still very limited data when it first came. But now, no, for confirmed 2019 nCoV infection, reported illnesses have ranged from infected people with little to no symptoms to people being severely ill and dying. 78%, 78%, 77 to 78% are asymptomatic. About 21% no, 70 about 21% is mild. So more or less pinagsama mo ang mild at saka yung asymptomatic, about 98%, 98 to 99% are asymptomatic and mild. Kaya yung mga tao parang wala lang, ganun din sa States. So wala lang kasi 98% are recovering. And among the countries ngayon, tayo ang may pinakamaraming death ang Pilipinas. So signs and symptoms, anong difference? Fever, a temperature of 38.5. Fever can be both signs and symptoms, ha? And then, of course, cough and shortness of breath. So, symptoms of 2019 nCoV may appear in as few as 2 days or as long as 14 days of exposure. This is based on what has been previously seen as the incubation period of MERS viruses. Again, tandaan ito ha. Tandaan ito na paragraph na ito at ito na slide. Okay? So most of the patients in the outbreak in Wuhan have reportedly had some link to a large seafood and animal market suggesting animal to person spread. Pero hindi pa ito napapatunayan. We are still waiting for the report of WHO. Kasi pumunta yung si WHO doon ngayon eh. About I think 3 or a month ago. Okay? So, dito sa atin, karamihan ay may mga party, close contacts, karamihan doon nagkaroon ng ano. So, it started cases nung dumami yung kaso sa EBRMC. So some patients in the outbreak reportedly have not had exposure to animal markets, suggesting that there are some limited person-to-person spread may be occurring. So hindi na siya limited, but indeed it is a person-to-person spread. Okay? And of course, via respiratory droplets, when an infected person coughs or sneezes, spread of SARS and MERS between people has generally occurred between close contacts. Okay? So, the WHO has assessed already the COVID that it is now, until now, hindi pa to nalilift, that it is public health event of international concern. So, pag sinabi yan, it's already the whole world that is affected. Of course, except yung, ewan ko kung merong COVID dyan sa Antarctica. No? I'm not sure if they have COVID in Antarctica. Okay? The risk from this COVID, from these outbreaks depends on the, of course, characteristics of the virus, including whether on how well it spreads between people, the severity of resulting illness. So, alam natin, even in Eastern Visayas and Tacloban, around less than 1%, no? Point something, no? Are severe, no? And the medical or other measures available to control the impact of the virus, for example, vaccine or treatment medication. So we have the vaccine, we have the mRNA, dalawa, that's the Pfizer and Moderna. We have the genetic, which is the AstraZeneca, no? And of course, we have the live attenuated virus, which is the Sinovac. Sinovac. Pero ngayon, pagka ikaw ay matigas ang ulo, magiging Sinovac ka na. Hindi na Sinovac. Okay? So, Wuhan City is a major domestic and international transport hub that where the COVID-19 started. Rico ha, natatawa ka sa Sinovac ko. Okay. So, during that time, napakadaming realization. Hospitals do not have triage areas. And I remember it clearly. We have visitors from Korea. They went to, hindi pa masyadong ano nun, mga nag-i-start pa lang yung COVID nun. And may visitors kami sa Korea. Alam mo naman mga Korean, para naman silang Chinese. May biglang umubo. Pag ubo, nandun sila sa SM. Nawala yung nagtakbuhan yung mga nagtakbuhan yung mga tao sa Save More nung pag-ubo ng isang Korean. Pero ang Korean kasi, kahit na hindi COVID yan, pirmi silang pirmi silang naka-mask. Okay? So, I think ang isang area na wala pang death ngayon is Vietnam. No, walang death sa Vietnam. Tapos ang Singapore, matagal na silang walang death. Ngayon meron silang bagong 6 na kaso na imported. Okay? Tapos nung bumutok sa EVRMC, most of the health staff do not have proper PPEs. Yung parang astronaut, wala, hindi sila nakaganyan, no? Nakaganyan man sila, hindi level 4. Kasi merong level 1, 2, 3, 4. Okay? There is no designated holding area. Kaya ngayon, ang lahat ng hospital may mga tent hospital. Ang init, kawawa talaga yung mga pasyente. Tapos, ang mga pasyente namamatay na lang. Alam mo, for the whole of February, for Tacloban alone, we have 184 deaths. Ang nangyayari, hindi na lang magpapacheck up kasi itatriage ka, napakatagal, itetest ka pa bago ka pa kapasok dun sa and hindi ka mamamatay sa COVID, matay ka sa init, matay ka sa mamamatay ka sa gutom, no? Because there is no designated holding area. And then there is no designated anteroom for staff to change and wear PPE. Kasi kailangan meron kang doning and doffing, no? And respect to privacy of patients and accompanying. Tapos, merong isang sikat na taga-Tacloban na nag-positive. So, ang daming nag-text sa akin. Sabi ko, I'm very sorry, hindi ko pwedeng i-disclose. Why? Kasi they are protected with Data Privacy Act. Nakalimutan ko yung RA, hanapin niyo na lang. Lalabas yan sa exam. Ano yung RA about the Data Privacy Act of the Philippines, no? Hindi ko pwedeng tapos hindi pwedeng i-text unless it is used for and not even social media. Okay? The difference between the first year before and first year now, no, is the recent Department Memo 2020-0439. Ito na ngayon yung Bible. Recently, it was October 6, 2020. They call it the Omnibus Interim Guidelines on the Prevention, Detection, Isolation, Treatment, and Reintegration Strategies for COVID-19. So when it started in January, nagkaroon ng March, na iba ng konti. And eto na ngayon yung kaya yung mga exam dati hindi na magagamit ngayon kasi it has changed, no? So this omnibus guidelines provides interim guidelines on surveillance, screening, contact tracing, quarantine or isolation, and testing as part of COVID-19 response. You got to identify what is the difference between a quarantine and isolation. I stop sharing first so I can ask some of you. Okay. Dr. Cindy Makamay, just there is no right or wrong answer. Anong sa palagay mo ang kaibahan ng isolation and quarantine? Sinong ina-isolate? Sinong kina-quarantine? Kay close contact ka? Taga-diin ka mo? Ng contact tracer namin. Saang barangay kayo? Wala man akong, ano apelido ng brother mo? Kailan siya nag-positive? Bakit siya nagpa-swab? Saan siya nag-work? Ay, okay. I remember. Bakit nandyan siya, hindi siya in-isolate? Dalawa lang kayo. Ah, yun. Okay. So ano ka? Are you isolated or quarantined? Okay. Sige, di ka sure ha. What about thank you for being honest of being yung kuya mo is positive. So, you should not go out ha. Hindi ka ba ite-test? Hindi ka ba isa-swab? Hindi nag-recommend yung nurse? Okay, tandaan nyo ha, wala siyang symptoms, siya ay close contact, at hindi siya ite-test. Okay? Ara, nag-answer na si Ara kanina, di ba? Sinong gustong sumagot? Anong difference ng Yani, you want to answer? Or who would like to answer?
Sige. Okay.
Difference between a quarantine and isolation.
Okay. As I remember, quarantine is the limitation of movement of people who are suspected with the disease during the incubation period before they manifest the signs and symptoms. But isolation is the separation of the one who are already sick from the people who will be susceptible. So like isolation is the separation of the people who have the disease, while quarantine is the people who are still being checked if they will have the
If
disease.
they will develop
Yes.
symptoms eventually. Okay. Doktora, paki-asterisk mo naman si Dr. Coritana para dun sa mamaya dun sa attendance. Just put an asterisk on her answer. That is very correct,
Okay
no?
po.
You quarantine before any symptom will develop of potentially, no? Na kung magkakaroon siya ng
Hello, sir?
symptoms, iko-quarantine siya, no? Iko-quarantine siya, hindi siya pwedeng lumaba. You have to limit the movement of the person. Okay? And of course, yung isolation, talagang may symptoms siya and kailangan yon the same with katulad ng kapatid ni Dr. Makamay, no, naka-isolate siya ngayon. So, kahit na, for example, Dr. Caritana, for example, confirm positive ako, wala akong symptoms, should I be isolated or quarantined?
Positive ka po, Doc, and you don't
Yes.
have symptoms. I think you will be isolated.
Yes, you will be isolated. Even though I don't have a symptoms, but I am confirmed positive with COVID-19, I still have to be isolated. Ha? Kasi positive ka na. Meron ka na. Hindi ka lang nagmamanifest, no? Okay. Very good. Okay. Now, the general guidelines of this omnibus is the implementation of the prevention, detection through testing, isolation treatment, and reintegration strategy shall be the cornerstone of response and shall be a shared responsibility of the national government, local government unit, private and public sector. Question, are you included in the shared responsibility? Yes or no? I need a thumbs up. Are you included in the, saan na yun? Hindi ko kayo makita. Sorry. Are you included? Thumbs up naman dyan. Okay. Included kayo ha. Hindi porke nag-aaral kayo hindi kayo kasama. It is your responsibility. Ayaw ka mo ang daming mga first year dyan, ada ka mo deskanso, kadadamong tao, no? Hindi, daming tao sa kayo ba, wait ha, sorry. Ano bang nangyari dyan? Okay. Ay. Nasaan na ako? Sorry. Nakikita nyo ba ako? Okay. Question.
Yes, Doc.
Sino na pwede ba ako makahingi ng reaction na puso? Sino na nagpunta sa inyo sa Bagong Robinson?
Ano nga Bagong Robinson?
Puso.
Ang newly opened or an
Diyan sa may Marasbara. Sino na nagpunta dyan? Pahingi ng puso.
Waray kwarta, Doc, Balayla?
Parehas tayo. Hindi pa ako napunta. Oy, walang pumunta, walang nakapuso. Oy, congratulations. Dr. Amerikano, please add 3 points lahat ng na present kayo. Hindi sila, walang pumunta sa ano? Sa Robinsons? Walang po, okay. Bibigyan ko kayo ng puso. 3 points. Okay. 3 points, 3 points. Pangdagdag yan sa ano? Pangdagdag yan sa exam. Okay? So,
Thank you, Doc.
DOH, as usual, you're welcome. DOH provide guidelines and oversight responsibility. Pero kami na local government unit, especially Mamuji, I work Monday to Sunday para dito sa mga prevention, detection, isolation, treatment, and reintegration. Wala na akong love life. Ano ba yan? So, ang ginagawa sa beach or magkakape ako, punta ako ng kay Dean, kasama kami ni Hotel Fides. Nag-picture lang minutes, kumain ng spaghetti, umalis na. Kasi dapat hindi ka although open air yon, kaya lang, kailangan talaga sumunod, no? And of course, external agency. Mag-aalas 6 na, no? Kasi marami ng tao dito. Marami ng tao dito sa hotel. Kaya naglalaban-laban na kami sa internet. Okay. Nag-enjoy pa ba kayo dyan? O yun nga, kailangan maging strategic din ako sa aking mental health issues. Kasi nga Monday to Sunday ako kanina, aga ko pa nagising alas 3. Tinawagan ako dahil sa hindi kasi nag-e-embalm ang St. Peter kung namatay sa bahay without a certification from Mamuji if it's Tacloban na hindi yan COVID. Sino naman paano ko malalaman kung COVID or hindi yan, di ba? So parang sumusulat na lang ako na hindi, ang ginagawa ko ay ask the barangay for a certification. Sinasabi ko yung certification na humingi kayo na hindi siya PUM or PUI. Okay, alam nyo ba ang PUM, PUI? PUM, person under monitoring. PUI, person under investigation. So, person under monitoring, ang mga naka-quarantina ay person under monitoring. Yan yung mga suspect, no? Person under investigation, yan yung mga probable na COVID-19. And of course, yung confirmed. Okay, I'm gonna continue, mga anak. Okay. So, the minimum public health standards are the hand hygiene, I don't call social distancing. I call it physical distancing kasi pwede naman din kayo mag-usap, no? Pero yun nga, nakaano pa rin. And because of this cough etiquette and wearing of mask, tinanong ako, I think I don't know if I shared it already to you. I was asked, di ba, umuwi mga OFWs. Tinanong ako ng RD ng DSWD, Department of Social Welfare. Mga mothers daw, mga nanay daw, nagtatanong, mga wives nagtatanong, pwede daw bang mag-sex during the COVID-19 pandemic? Teka, di ko alam paano ko sasagutin. Ha? Ako, nakamas, paano ba yon? Oo nga, eh, kasi kung galing ka ng galing ka ng Middle East, galing ka ng puwede ba? Sabi ko, eh, paano 'yun? Just be creative na lang. Tapos sabi sa akin ng director, baka puwedeng na lang, baka puwedeng Mariang Palad. Mariang and nakikita lang natin is the COVID-19. But we fail to see ito ng mga mental health issues connected with this COVID-19. Alam nyo ba kung ilan ang may depression ngayon among high schoolers dahil sa module na yan? Itong modular. And ilan ang nare-receive po ng mga death certificate na nagsusuicide? So kayo, mentally okay ba kayo? Eh, sana naman nag-watch kayo ng aking Made to Love, oh. May mga nag-watch, 'di ba? Yung iba hindi nag-watch eh. Siguro you are already in love, no? And these things talaga, tinatanggap ko yung mga ganyang mga ganyang speaking engagement para maiba yung buhay ko. Kasi kung hindi, hay nako, baka naman hindi ako ganito kaganda. Joke, no? Inaaliw ko na lang yung sarili ko paminsan-minsan. Kaya please, wag na lang kayong mag-a-absent, ha? Meron na namang absent ngayon, 7 or 8. So, yung mental health issues of this COVID-19 is napakahalaga. Pangalawa, yung iba ayaw na talaga magpakonsulta. So, titiisin na lang ang nararamdaman nila kasi magkano ang RT-PCR? 5,800. Mura na yun kasi dati 6,500. Ikaw, even if you have the capacity, mahihirapan ka pa rin sino magpapatest sa inyo na magbabayad ng 6,500? Eh kung may libre naman, di ba? Palibre ka mo. Yes or no? Libre, di ba? Papalibre ka mo. And ito yung kaya nung nag-press con kami, I hope you watch the press con with Mayor. Magkano naman kayo sa pag nagpe-press con kami, panoorin niyo man si Mamu G. With the press con. And yung press con na yun, ano na ba yung vaccine. And tama talaga si Mayor. Why will we be spending 150 million worth of vaccines na up to now, emergency use pa rin? Na up to now, mayroon namang order ang gobyerno. Bakit ako di ba? So, why not coconut? Okay? So, meaning, public health, you are only first year. Public health and community medicine is not just studying about those programs. Governance is a very, very crucial issue. And the health system development is a very, very crucial issue in making these programs succeed. TB, HIV/AIDS, malaria, schistosomiasis, COVID-19, measles, and everything, even chronic diseases. So, ito yung issue ngayon doon. That's why it's very important yung balance between public health and the clinical. Hindi ka lang matatapos sa pagreseta mo ng ito ngayon, wala namang gamot. Di ba? So, let me continue. Okay? So, the minimum public health standards which all of you must memorize is this hand hygiene, physical distancing, cough etiquette, wearing of mask shall be strictly implemented across all setting, regardless of severity of risk. Kaya bida, no? Bawal lang hindi nakamas, isanitize ang kamay, dumistansya ng 1 metro, alamin ang tunay na katotohanan. Ang tamang impormasyon, sorry. So, you need to carry versus scary. Okay? Letter C, contact tracing shall be initiated after case investigation of every reported, probable, and confirmed COVID case. Very important, kaya siya may asterisk, sino ang close contact? So, Dr. Makama is now a close contact, no? It shall refer to persons who has experienced any of the following exposures during the 2 days before and 14 days after the onset of symptoms of a probable or confirmed case. Face-to-face contact within 1 meter or for at least 15 minutes. Siya siguradong close contact kasi nandyan sila sa bahay, mag-isang bahay. Number 2, direct physical contact with a probable or confirmed case. Later, I am going to differentiate what is a suspect and what is a probable. Direct care for patient with probable or confirmed COVID-19 case without using recommended personal protective equipment. Okay. And other situation as indicated by local risk assessment. So contact tracing shall also commence for contacts of suspect cases upon detection, while waiting for specimen collection for SARS-CoV-2 diagnostic testing or while waiting for RT-PCR results. If you are probable, kailangan ka ng i-contact trace. Okay. So proper clinical assessment shall be the basis for quarantine or isolation and testing algorithms anchored on two main factors. Do you have the symptoms or not? What is your exposure? Yun lang palagi and shall reflect the most cost-effective intervention following the pretest probability framework. Okay. If if I am a close contact, katulad ng case ni Dr. Makamay, she will only be quarantined. Only. Why? She has no symptoms, no? She has no symptoms although she has an exposure. We can quarantine or isolate and test at the moment na if Dr. Makamay, is a healthcare worker, even though she's only quarantined, she can be tested. Okay? Or test only. For example, test only without the nagkaroon ka ng you have symptoms, you don't have the symptoms, but you are only exposed to make sure babayad ka, you can be tested only. That we do a test only. Okay? So the difference of isolation and quarantine shall be emphasized. You isolate by separation of sick people with a contagious disease from people who are not sick. Katulad ni Miss Makamay, her brother, is at the second floor with own CR and own room, no? Quarantine, separation, and movement restrictions of people who were exposed to contagious disease to see if they become sick. Okay. Now, all contacts of probable and confirmed case, no, and traveler shall be placed under quarantine. What is new? That was October. By March 1, wala nang quarantine ang mga travelers. So this has changed already. Okay? In the event that they develop symptoms or test positive for COVID-19, they shall be isolated. All suspect, anong suspect? Ang suspect, you had a history of travel, you had exposure, but you don't have a symptoms, you are called suspect. Probable, you had a history of travel, you have contacts with a confirmed case, and you had signs and symptoms of a respiratory infection or diarrhea or body malaise, you are called probable, or you have a test but there is no result yet, or you have a test, however, it is not accredited by the government. So, parang may RT-PCR ka pero hindi yan yung ano ng government or yung antigen. Okay? Pag-confirm, of course, positive. All suspect, probable, and confirmed cases shall be isolated in the proper facility depending on the severity of symptoms. If you are asymptomatic, confirmed, and mild cases, you will be placed in the TTMF. Anong ibig sabihin ng TTMF? Temporary Treatment Monitoring Facility. Moderate cases will be placed at level 1 or level 2 hospitals. Ano ang mga moderate cases? You are already branded as moderate cases if you are pregnant, if you are, of course, extreme of age, senior citizen, and if you have comorbidity, no, if you have comorbidity, you are considered moderate cases. And then, of course, severe and critical cases will be at level 3 hospital that needs ventilation and assisted respiration. Okay. One of the best public health intervention to reduce the infections in the population and stop the spread of COVID-19 is through contact tracing. It means finding everyone who came in close contact with a suspect, probable, or confirmed person with COVID-19. People in close contact with a suspect, probable, or confirmed person with COVID-19 are at high risk of becoming infected and of infecting others. So how it works? No? There are three basic steps that I want you to know. Okay? No? Ito yung ginawa sa kaya importante yung spot map. Ito yung ginawa nila sa nung Ebola, no? What they did is in order to do an early detection of those who may have the virus, they isolate the contacts to prevent further transmission. Sa atin, ang ginagawa, nagla-lockdown, no? So, nabasa natin sa mga yung nagla-lockdown, di ba? So they were able to lock down. They succeeded. However, after the lockdown, yan na naman, no, sa Singapore and bumalik na naman. Okay? So, step 1, identify and list close contacts. Again, the definition of close contacts, if you are have exposure with a confirmed past case within less than 1 meter or 15 minutes or more, you have a direct patient care of a confirmed case without proper PPE. Anong pangalawa? Anong pangalawa? Forgot already. Ayun, direct physical contact, no? Nag-handshake ka, nagbeso ka, kumain kayo, no? Marami. Lately, kasi marapit yung Chinese New Year, yung mga kumain, nagpaka-positive, no? Alam ko, meron sa inyo nagtataka niyan. Baka gusto nyo akong i-PM. Totoo ba na si ganito, si ganyan positive? Of course, hindi ko kayo sasagutin. Baka ano to? Data privacy. Okay? So, the way to do the contact tracing in public health, kayo bilang mga public health workers, yung index case, yung nasa gitna is the index case. Kailangan, mo yung friends, household members, community, healthcare providers, karamihan yung mga yung mga nagpapa-check up. Tapos wala silang COVID, pero after 2 weeks nagkaka-COVID kasi nagdadialysis. Okay? And then work colleagues. So step 2 is inform and profile close contacts and determine the nature of exposure. Again, symptoms, exposure. So, a person's activity will be reviewed, no, 2 days before the onset of symptoms and within 14 days or until the person turns out negative on the repeat test. What is the changes here? Hindi na tayo nagre-repeat test, hindi na tayo nagre-reswab. Okay? And then, kung ikaw'y magko-contact tracing, tatanungin ka, where have you been? You came to visit the Queen? No. Ang daming sinungaling. Kaya in contact tracing, it's very important that you do a cognitive interview. Gagamitin nyo yung utak nyo at saka yung critical thinking. Hindi kayo basta-basta na lang mag-a-accept nawala siyang travel. It happens. Just 2 weeks ago. Kasi kaibigan namin, prominente, rich and famous here in Tacloban, we ask the standard questions, but still deny that they have traveled to Cebu. May travel sa Cebu, infected 5 more. So then, ida-diary mo, what have you been doing? No? Activities or social gatherings attended. Nag-Valentine ba kayo? Nag-Chinese New Year ba kayo? Nag-birthday ba kayo? Karamihan yan dyan nagpa-positive. No? Or kung nasa kayo, opisina, hindi kayo nagpa-practice ng physical distancing, hindi nagmamask. No? After you close contact, you will inform them about the and they will quarantine. Pero you have, while you are on quarantine, what comes to look for. Kaya meron ng monitoring sheet. And in the event there will be a symptoms, how they will be or and what to do in the event of a symptoms. They have to out again. Tapusin ko lang doon ako sa day, doon na lang tayo mag-breakout rooms kasi ako doon na ako sa kasi mas malakas yung internet ko doon. I'll just finish the coronavirus, COVID. Okay? Step 1, identify. Step 2, ano yun? Ano yung step 2? If you're listening.
Inform.
Okay. Okay, very good. And step 3, manage and monitor close contacts. Okay. There are 2. Dr. Makamay is a close contact without symptoms. Anong gagawin sa kanya? She will be quarantined. Okay? She will be quarantined and monitored within 14 days for symptoms. Ideally, community quarantine center. Pumayag kami na home quarantine depending on the parameters. Now, nag-change na rin ito. Hindi na 14 days but 10 days na lang. Okay? She will be observed 10 days. Pang ilang days ka na, Dr. Makamay? Ika-7th day, laya ka na sa Sabado. Pero nag-disinfect na kayo ng bahay nyo? Mm. Pwede man kahit yung Clorox, imimix mo lang yung Clorox, keep on Oo. Okay. So, okay. So, either the close contact without symptoms, close contact with symptoms, they will be isolated kasi most likely they will turn out positive. Now, the thing, hindi minus 2, 7 na nagpa-swab. Doon sa 7 na yun, okay, sa 7, sabi ko, yung 3 should have a repeat swab on the 5th day. Why? Because I noticed may continuous exposure dun sa dalawang nag-positive initially. Bali, tatlo na kasi. Nag-iba ang index case nung nalaman kong may travel yung nag-positive. So on the 5th day, ni-repeat swab ko ang tatlo out of the 5. Diba? 7 sila. Diba? 7. Dun sa 7, may positive. Prior dun sa 7, ang nangyari, sabi niya may asthma attack siya. So she was confined in the hospital but turned out to be positive. Yung index case initially. Therefore, yung 7 are already considered close contacts. Yung 7 na yon, out of the 7, dalawa ang nag-positive. Yung isa doon, asawa nung na-admit. Yung isa, pinsan nung, baka masabi ko tuloy kung sino ito nag-positive kakaano ko. Yung isa doon ay kasama doon sa nag-lunch. So, may 5 na, sa 7, may 5 na negative. Ha? Sa first ano. Yung tatlo, pinaswab ko. Repeat on the day. Why? Tatlo ko, yung isa, anak nung na-confine, at nung, of course, nung asawa, isa nag-positive. Yung isa, asawa nung nag-positive na isa. Di ba? May tatlong nag-positive. Yung, bali, dalawa mag-asawa na. Yung isa, mag-anak nung ano. And then yung isa, while on the 5th day, from the time na nag-expose, nagkaroon, sabi niya, masunga-sunga. Pina-swab ko. Lo and behold, lahat ng tatlo na yun, nag-positive. So, kaya, ilan na sila? 6 na sila out of 8 na nag-positive. Okay? So, ganun din nangyari sa isang case sa RTR. So, may hindi ka dapat case to case depending on your analysis. Okay? So, hindi mo kailangan mo i-test. Bakit ako i-test negative? Kaya yung iba lumalabas. Huwag kayong lalabas, huwag kayong lalabas kapag kayo ay nagpa-test. Because the fact na nagpa-test kayo, ibig sabihin you are a probable case of COVID-19. Sino yung sino nagsabi mag-ask ng question? Sige. Yes. History of travel na may cases. Cebu, Manila, of course, Calbayog is high risk, Qatar, basta merong cases na madami. History of travel with cases. Pero tayo may community transmission tayo. So meaning talagang we are taking into consideration all region 8 are at risk. Pero tatanungin mo pa rin, have you been to Palo? Kasi daming kaso Palo. Have you been to this and that? Yun. Any other question? Kung kayo ay maging close contact, please do not go out. Isolate yourself. Hindi lang quarantine, isolate talaga. Okay? Okay. Ang pinaka-best na makakatulong sa atin is you do a contact tracing tree. 'Di ba there were 5 colleagues, friends, community, health facility, at saka household members. If you are a confirmed case, close contact first generation contact si Cindy, 'di ba? But her brother has a general contact kasi yung nasa Bureau of Par siya. So may mga siya clients. Sinong mga close contact niya? Katrabaho niya, kapamilya niya. Meron ba siyang mga friendship na lumabas sila? Tacloban din siya na BFP? Sa region. So, dapat doon nga siya nakatag. Sige, pero kasi taga Tacloban eh. So, ngayon, ang second general close contact are either ang kanyang second, halimbawa, may nagpunta sa inyo, no? Nandiyan, nagpunta, nakikain. Second general contact yun. Hindi siya close contact. Okay? And of course, the third general close contact. Yung pinaka-darker, yan yung that's the one you will focus on the contact tracing. Okay? Now, there are two cases, di ba? You are a positive RT-PCR and no symptoms. You are positive but with you have symptoms but you are positive RT-PCR. If you are positive but with no symptoms, okay? Okay, I'll explain. With RT-PCR but you don't have symptoms, kailan ang day 1 mo? Hello, bakit wala kayong mga muka? Dr. Ace Ange. Positive ka with RT-PCR, wala kang symptoms, kailan ang day 1 mo?
From the day po you receive the result.
Okay. Ang sabi niya, from the day you receive the result. Do you agree, Dr. Aliposa?
From the testing date.
On that day na naswab po siya.
On the day na swab. Do you agree, Dr. Timbal? Michael, you answer kanina. Kailan
Yes, Doc.
ang day 1? Ano? Ano yung yes,
Testing
Doc?
date. Testing date.
Okay. Okay. So if you have no symptoms but you are positive with RT-PCR, the day that you were swabbed is your day 1. Doon ka magka-count. Okay. Since that is your day 1, magbabacktrack ka ng 2 days kung sino yung nakasalamuha mo 2 days before ka nagpa-test at nagpa-swab, yan ang possible mo na close contacts. Friends,